Welcome back to 21st Century Conversations. We're talking about health and wellness. We're talking about outreach. And we're talking about Mayor Toni Harp's vision for the city of New Haven in terms of community services and wellness. I am joined now by Dr. Martha Okafor. She's the City of New Haven Community Services Administrator. She's fairly new in town, and I'm sure she's getting her feet wet with the uniqueness of New Haven. Welcome.
Oh, thank you. Thank you for having me on the show.
You are very welcome. You have a big job ahead. You know, the mayor is the first woman in 375 years to lead the city. So there are all kinds of expectations of and about her. And as you are here to represent her, we of course want to know what's her vision for community services, and for health and wellness for New Haven. We have all kinds of problems in New Haven. We have all kinds of good things. So what is she up to about this?
Well, the mayor, as you said, is very excited about the opportunity to serve the people of New Haven.
Yes.
Her vision is actually to focus on the people. She believes that people are the most important thing that we have to do, and that we need to look at how do we make the city to be a healthy, vibrant place for people to live, for people to work, for people to actually age well, healthy and well. So her vision in essence is really how do we make this city a clean, safe, healthy place where people can be the best they can be.
Yes, I'll tell you, she sets a good example because she looks incredible for someone who is a baby boomer at the far end of the booming. She looks fantastic. So what specifically is she doing? I know she was very concerned about the murder rate, especially for young teens. She was just, really distressed by what was happening in New Haven early, and she has started all kinds of projects to address the violence piece. And I know that she cares deeply about healthcare issues. So what specifically, you as the Community Services Administrator, tell us what's your specific role? What are you charged with doing? Okay,
so I'll start first by explaining, what made the mayor to be very interested in looking at violence as a critical issue. As you know, when she ran for the election, there were three important things that she felt are critical. One is that we need to have a safe place. It is hard for us to talk about health if people feel unsafe. And she felt like having a safe place will also improve our ability to have a city that economically is booming and that people are comfortable to go to school, they are comfortable to actually live there and age well while they are living there and have their children born there. She also felt like it is important for us to look at how do we in City of New Haven, we are staying at the backyard of one of the top hospitals in the nation and in the world, Yale Hospital, and we have great academic institutions in the city, a lot of them very notable, and yet we have population, we have 772 people that live there. And how come we have such disparities?
You mean
that we have
129,000?
Yes,
and we have great disparities.
And we have great disparities, considering that out of the 129,700 plus people that live in the city, that about 33% of them are African Americans, and you have about 31% of them that are white, and then you have about 27% of them that are Hispanics, and the rest are other people from other cultural, racial, and ethnic heritage. And the question is, with all of that, we still have a very high disparities in health, in socioeconomic status, as well as education.
Now, what percentage are Hispanic?
We have 27.
27%.
Yes, ma'am.
Hispanic.
Yes.
Wow.
Yes. So New Haven is very diverse.
Yes, it is.
And and that is why one of the things she cares about is how do we make New Haven, the city, one strong, healthy, safe, and vibrant city, regardless of people's origin, regardless of their status, that we all come together being a place where the neighbors, people care for each other, and we know our neighbors and really take care of each other so that we can benefit from all the assets that we have from hospital, from the academia, and also from great people that live in the city and work there.
You know, you said something that I think is so key, because New Haven has one of the best hospital or health system, because Yale is no longer just a hospital, it's a health system. Yes. It owns everything in healthcare in the area. And we have one of the best universities. We have some of the best magnet schools. And we have some really outstanding pre-K to 8 schools. And yet still, we have some of the largest disparity gaps between the 21% Caucasian who live in the
31% Caucasian, 33 blacks,
31%
and 27 Hispanics.
Yes.
Percentage.
Now, when you think that Hispanics and blacks together make up the majority, they actually make up 60% of the population. And we have these great schools, yet still there's such great disparities in health and wellness, in economics, and in education. So you're saying, so the mayor is very concerned about these things. You want a strong, safe, healthy, and vibrant city, which I think we would all want. So what is she doing to bring this about?
Well, the mayor recognizes that the city cannot alone address this issue. So one of the key strategies she's doing is really partnership. Yes. She believes that there is a lot that we have going strong in New Haven. We have a lot of non-for-profit organizations. We have a lot of businesses in New Haven. We are the #1 foodie city in the nation, which means we have healthy foods and restaurants that are reflective.
Yes, we have some great restaurants.
Yes, we do. And we have great parks, and we have a walkable city where people can actually be active. But as an urban city, we also are challenged with other things that come with being an urban city, like crime, and we have a lot of work we're doing in that area, which is why safety is very key to her success and what she's trying to do. And I can tell you example of what we are doing in that area.
Okay.
Since her leadership, we have actually done amazing job in collaboration to look at youth and work on how do we actually keep our youth engaged, keep them in school. How do we work on partnering with our police department? As you know, we have community policing in increase, so that our police will be seen as part of the community and not just there to keep, just to look at who is the bad person, but actually part of the community and supporting them. We have tremendous job. I think this summer is the first time we had more youth engaged, and we also have many of them working, so we are training them to have that experience so that they could learn what it means to have the work ethics and have some experience under their belt. We have after-school program where we work with the community organizations to set up a lot of programs and sports, community sports in the community. We have an interesting initiative we call Youth Stat.
Youth Stat?
Yes, Youth Stat. And Youth Stat is actually a partnership with our Board of Education, where we identify youth that are struggling or faced with different challenges. It could be absent parent or absent fathers, but they have attendance issue, they have truancy and other issues, and we provide, working with Board of Education and other community members, we are providing care coordination for them and wrapping around them services they need so that we keep them in school. Including tutoring, we will be increasing their academic performance, as well as making sure if they have emotional or social or behavioral problem that we provide them, connect them with the services. So there is like a list of services based on the youth's need that we will be working together so that the youth will feel not only supported, but encouraged and empowered to do the best they can. Another area is on the health, is our partnership, for example, with the federally qualified health center, like you had.
Like Fairhaven?
Yes, Fairhaven. And we have another one, the Hill Health Center.
Yes.
Which is another
Cornell Scott.
And our intent is to partner with our community health clinics. We have school-based clinics. So we have different organizations that are providing access to healthcare services. But most importantly to the mayor is her strong belief that prevention works. So, and that is one area that we'll talk about in terms of what are we doing to really make our condition to promote health and wellness and prevent illness.
Now, we are going to have Dr. Lagarde join us back because I would like to hear from the both of you how you are working together, collaborating. You have given us so much to talk about. So let's just recap before Dr. Lagarde joins us. Let's just recap. Dr. Okafor just told us in the most precise and concise manner that Mayor Harp is very concerned about the disparities that exist in New Haven. She told us that in the city we have 33% of our population are African Americans, 31% are Caucasian, and 27% are Hispanics. We have one of the best health systems in the Yale Health System, which is now also includes the Hospital of St. Raphael's campus and several other health centers. We have Fairhaven, as we heard earlier. We have the Cornell Scott Hill Health Center. These are all outstanding healthcare facilities. And we have Yale University, we have Albertus Magnus, we have University of New Haven. There are so many excellent schools in our area, and yet we have some of the widest disparities between blacks and whites and Hispanic. And the mayor, Mayor Toni Harp, the first woman in 375 years to lead the city of New Haven, is taking on the challenge of reducing the disparities, improving the health of our community and the safety. She's very concerned about youth engagement, and she's working on addressing that. Community policing, training our youth, having after-school programs and in both academic and sports. She is collaborating with the Youth Stat Partnership, through the Youth Stat Partnership with the Board of Education. She's offering wraparound services such as tutoring and behavioral health services, and health collaborations with both Cornell Scott and Fairhaven. And so now Dr. Lagarde is going to join us, and she and Dr. Okafor are going to tell us how they're working together to bring some of the mayor's wishes for a healthy and vibrant community into sharper focus and into operations.